Welcome everybody, good afternoon. Nice to see the media. I'm flanked by our two experts, Dr. Brink and the Chief Executive, Paul Whitfield. They'll be speaking to you shortly. And of course we're broadcasting from Kandy today, and perhaps it's opportune because outside there's Victor Hugo looking over the islands. And I'm just thinking in due course if they erect a statue to Dr. Brink, if she'll be looking at her slides. And we'll have a picture of her looking at her slides, but we'll find that out in due course. But it's a week ago today that the borders were relaxed, and hopefully, if all goes well, and we believe it is going well, there's no reason to say the contrary, in 2 weeks' time there'll be further relaxations. At the moment, all regions, countries are classified as either 3 or 4. And from last week, if you're in region 3, category 3, the restrictions were made less onerous, and we opened our borders to that degree. What will happen on the 14th of May, if we progress as we fully expect to progress, there'll also be Category 2 available. Now, Category 2 will mean that you'll be tested on arrival. You'll be obviously have to be in isolation till the test result is given. If it's negative, you go about your business. There'll be a passive follow-up, and Dr. Brink will explain what that means. And at day 7, you'll then have a second test. But to all intents and purposes, if you are from a Category 2 region, assuming a negative test, you'll be able to go about your business, enjoying Guernsey with your family or doing business as the case may be. Now, in relation to what will happen in respect of how you get here and the regulations otherwise, Mr. Whitfield will talk about those in due course. He will remind us about some of the practical requirements we ask of people who come into the bailiwick. Now, if you're planning to travel or you have friends or relatives coming, make sure they're aware of the rules and provide the right information before they set off. Now, naturally, as we are relaxing, but in a prudent and sensible way, the rules and regulations about people coming into the bailiwick, there will be people who will be concerned. Naturally, after the restrictions that have been in place now for more than a year, we're saying do not worry. Because as Dr. Brink will elaborate, both the testing and surveillance programs mean we're very careful about the risks, and avoiding a third lockdown is our priority. But we've now got a vaccine program, and again, Dr. Brink will give you more details about that shortly, which is a great success. Over half our population have had at least one dose. Now, that will be, going forward, one of our main lines of defence in relation to COVID. In fact, that will take over really as our main line of defence from our borders. Now, as things stand, on the 14th of May, Jersey and the Isle of Man would also immediately become Category 2. Now, people have quite reasonably been asking now for several weeks about an air bridge, or what we call Category 1 with the other Crown dependencies. Now, being absolutely realistic, because we're now at the end of April, that is not likely to happen in the very near future. But we remain open to discussing it, and Category 2, as I say, will come into play in 2 weeks' time. Now, with the good news, there's a bit of, not bad news, but a bit of realism in the sense that on the 14th of May, as well as the introduction of Category 2, we will go ahead with the introduction of a £25 charge per test for those coming into the bailiwick. There are some exceptions, but there are not many. Children under 12 will not be obviously charged. Those travelling for medical reasons and those accompanying people who are travelling for medical reasons also will not be charged, and also people travelling on compassionate grounds. Now, finally, with regard to the July the 1st date, we've said that we expect the remaining significant restrictions to be removed. That remains the case particularly to the UK, Jersey and the Isle of Man, and we're still considering precisely how that will work. But we do expect, again, that to progress. There's no reason why it shouldn't. We're aware of what's happening in the UK and other places. Now, whether you call it a passport or a COVID certification, we're also looking at some form of that kind of documentation. Dr. Brink mentioned that at the last briefing. Now, nothing on this is final, but everything is still looking positive for meeting the kinds of timescales that we set some weeks ago now in the bailiwick blueprint. So we're moving forward at a pace, but at a pace which has regard to the fact that we still need to be cautious. So there are still challenges ahead, but we believe we can now meet them. Anyway, enough from me, and over to Dr. Brink.
Thank you, Deputy Fabrish. So as ever, I'm going to give you an update of where we are, but then also focus on some hot topics, our testing strategy, vaccination, and finally moving forward. And I think bringing those together in a singular way is important as we move forward. Now, if you look at our general update, I think you're well familiar with the first and second wave, the first wave being far smaller at 252 cases, the second wave being large at 511 and caused by a variant of concern. We had the small number interwave between wave 1 and wave 2. And just to remind you, for those of you who want to focus on how we'd manage cases in the community, in October, November of 2020, we detected a cluster in the community and we managed to control that cluster really quickly without significant onward spread within the community. And I think it's important to remember that as we move forward. Post-wave 2, we've had a single case. That case was detected on the 12th of April, so a single case detected then. But we have now been 63 days where we've had no cases of community transmission. An important milestone for us. I thought what I'd also do is bring the testing strategy together, how we're viewing it. And we're looking at the testing strategy not in a singular way. It's really got 4 components to it. So the first is our symptomatic testing. So symptomatic testing is really important, and we're encouraging everyone who has any symptoms whatsoever to come forward and be tested. We intend retaining the clinical helpline, which is free. We can have free testing through the clinical helpline until at least the end of this year. That'll encourage people with symptoms, however mild, to come forward and get testing. Surge testing served us very well in the second wave and would use it again should we detect a case in the community. So surge testing is where we can't necessarily link a specific case with a specific contact, but there'll be an area that we're concerned. And you're familiar with areas that we were concerned about before. So we had a number of cases in the schools. We had various large events and locations. And we put a lot of testing around those areas to detect any asymptomatic cases. The whole point of that is to detect those cases before you have those chains of onward transmission. Surveillance testing is what we're doing a lot of at the moment, and that's when we've identified groups of individuals, so people working at our borders, education, people working in bailiwick law enforcement. We've also been doing various testing in health and social care, ambulance service and so on, where we identify groups of individuals and we put them on a testing program. The aim of that is to detect any asymptomatic infections and then work around that to identify any possible chains of transmission. So that surveillance testing is important as our population becomes increasingly vaccinated. So at the moment, the surveillance testing forms a key part of our protection within the community, but we'll look to phasing that down as our population becomes increasingly vaccinated. So when I showed you those scales earlier on, it's always that balancing that we do. Sequencing of variants of concern is also something that we are developing an on-island capacity to do. So the reason why we want to do that is some variants of concern, for example, the B117 or the Kent variant, we know responds very well to the vaccine, but we want to know if we have a new virus identified, a new case identified on the island, we want to be able to look at it very quickly to see if it's a variant of concern. And if it was a variant of concern, we'd do more extensive contact tracing than we'd do for a variant of the original SARS-CoV-2 virus. So it would modify how we manage infections, particularly in a background of a vaccinated population. We want to know, should we be concerned about this, or is this one that we feel we can manage easily? So those are the 4 arms of our testing strategy, and I thought that would be useful for you to have a look at that. So I also wanted to give you an update and overview of the progress of our vaccination program. And the first thing I want to do is ask you to focus on the photograph that you'll see there. It's something that I'm immensely proud of for the team. And it was the day after we went into full lockdown on the 23rd of January. The team didn't break step. The next day they were there, continuing with the vaccination program in full PPE. And I think that was the spirit of the team. It was, right, now that we know that we're moving into a second wave, and we'll vaccinate in full PPE, we owe the group of individuals and the people that supported that program a huge debt of gratitude as an island. They didn't break step, they simply went on with their job and changed the way they were working. But looking at the vaccination data on a wider basis, what I've done is I've presented in a slightly different way today, and this is based on questions that some of you have posed to me. And so I've got the whole population data, the over 16 and the over 18. So just to remind you, at the moment, the vaccination program was targeted at over 18s at the moment. And if you look at that, 38% of that population have had one dose, 2 doses, 28%. So 66% of that population have had at least 1 dose of COVID-19 vaccine. So something to be really, really optimistic and really pleased about. The over 16s, 36% 1 dose, 26% 2 doses, and 62% overall. We've also calculated our whole population coverage, and that obviously we're not vaccinating the under 18s at the moment unless there's a specific clinical risk and reason to do that, but the whole population, at least 52% have had at least 1 dose of vaccine. So that gives you a snapshot of what it looks like on a population base. So I also have had some queries about the 75 doses per 100 population and how that aligns with the other data that I'm presenting to you. Now, I think most of you know it's not an indicator that I'm terribly in favour of, but we do it because it is an indicator that is published worldwide. And if you look at data sources such as Our World and Data and so on, they'll use the total dose per 100 population. That's the total dose. It's not the total people immunized, which is why the number looks higher. So, for example, if you look at Israel, which has got the highest vaccination coverage in the world, their levels are, I think, 121 per 100. So it just hopefully gives some explanation and background as why those figures look slightly out of kilter. But all in all, we've now delivered just under 50,000 doses of vaccine to the population. So again, I think there's something that we can be very pleased about and very proud of. And it's, again, a huge thank you to all of those involved in the program. The other thing that we've tried to do is look at the vaccination program timeline and give some quite detailed information on that. Now, of course, this is critically dependent on the vaccine supply continuing as we expect it to continue, and also for us not coming across any changes in the indications for vaccination as we get more information. But as things stand today, the phase 1 program, the priority groups 1 to 9, is everyone who is involved in that group should have had their first dose by the 10th of April, those who want to be vaccinated. And anyone who hasn't, we'd encourage them to come forward and let us know who they are. We're planning to complete that priority group with dose 2 on the 12th of June. If you then look at phase 2 of the program, phase 2 of the program is, of course, the 18 to 49-year-olds, and we've started that on the 13th of April, and we'd anticipate completing the first dose of all of those individuals by the 27th of June, with the subsequent second dose being completed by the 31st of July. Now, if the last 2 dates seem slightly close together, just to remind you, is that we'll be using Pfizer-BioNTech as per JCVI recommendations in the 18 to 29-year-olds. That's why that time frame looks a bit shorter than the 10-week gap. So that gives you an idea of the vaccination program. Just before I go back and go on, there are a few things about the vaccination program, sort of hot topics that I've been asked about. One is about students. What we're saying to students in the UK is register with a GP, and then they will get called up in line with the protocol in the area that they're in. If they've had 1 dose in the UK and they come back to us over the summer, we'll give the second dose to them here. If they've had nothing, we'll do the whole program for them. So we will fit in with whatever they've had. But we would say to them is, if you have the chance, register with a GP, and if you have the chance to get vaccinated in the UK, it's obviously beneficial to get vaccinated as soon as possible. But whatever stage they're in, when they come back to us, we'll then carry on with what they've had and where they are. I think the other point that is I've been asked a lot about is the booster program. And it is very likely there will be a booster program. We're anticipating delivering one in the autumn time. I think it'll probably be with the same types of vaccine that we've got at the moment. I think possibly in 2022 you'll see boosting with a slight variant vaccine based on the variants of concern. But there's some big unknowns about that at the moment. But within our planning, we're planning to deliver a booster program within from September onwards this year. But we're waiting for final guidance on that. So I'm going to focus a bit on travel and regional classifications, and I know you've seen this before, but just to remind you to focus on Category 2. So Category 2 is less than 30 per 100,000. It's a 14-day average that we use, and if you look at the criteria for that, it's a test on day of arrival, as Deputy Fairbrash said, with a further test on day 7, and self-isolation until you receive that negative result on the day of arrival. And Category 3 and 4, I think most of your viewers and listeners are already familiar with. So one of the things that I wanted to focus a little more on is what passive follow-up means. So after the receipt, if you arrive from a Category 2 country, after receipt of your day of arrival test, you then remain in passive follow-up. You'll have a further test on day 7, but you remain in passive follow-up until day 14. And passive follow-up, really what we're asking people to do is to be sensible and think about times where transmission of the virus would be very impactful. So we're asking people to be vigilant about symptoms, and if they do have symptoms, to phone the clinical helpline. As I said, we're retaining that, and it is free. We also are, if someone's in passive follow-up, we don't want them to go into a nursing home, we don't want them to go into the hospital, unless it's an emergency, of course, or unless it's a planned visit. So there are situations where we'll arrange visits under very defined circumstances for people who are in isolation, passive isolation, or even in self-isolation, is if, for example, they are visiting a critically ill relative, end-of-life visits, and so on. So it's really important that if someone feels that they're in that sort of situation, that they discuss it with us. And again, if you're going to see your GP, it's just inform your GP that you're in passive follow-up so they can make sure that you're seen at the right time in the right place. What we're also asking, and I have to say, when we previously did passive follow-up, and even now people are being really helpful, is that try and just keep a list of where you've been. So if you do test positive on day 7, we can then go back and look at what interventions we need to put in place over that period of time. And that, again, will help us in the event of us having to contact trace. And I think it's important to acknowledge that with these changes, it is likely that we will see cases of COVID-19, but we've got all of the systems in place to try and manage these as safely as we can. So some of the key interdependencies as we're going forward, and don't have to go through all of those in details, but the decreasing internal restrictions, we've obviously got nothing, no NPIs internally, the decreasing border restrictions, our increasing vaccination levels. We're continuing our test and trace capacity, so all of our test and trace team are now doing their other jobs, so they're working on the healthy weight strategies, so other major public health programs, the cervical screening programs, so all of those we're working on, but if necessary we can move them back into doing test and trace, and we've always promoted that very flexible working. And we've talked about surveillance and the variants of concern. And so as we move forward, if we look at our focus up until the end of June, it's really a focus on the prevalence of infection. But as countries become increasingly vaccinated, what you're going to see is people are going to become less reliant on the prevalence of infection, because it's likely that people will do less testing and more reliant on vaccination levels. So as we move into July, the focuses will change onto individual vaccination as well as to vaccination status of a country. And that'll then provide our main road of protection. And then finally, if we look at our key considerations post-July, we've talked about the vaccination status. Deputy Fairbrash mentioned COVID travel certification, so that'll not only be vaccination, but also looking at other things people may require, for example, COVID tests, evidence of a past infection. We, of course, within our planning, are looking at what we'd have to do in the event of a further wave. We're hoping to avoid it, but it would be absolutely inappropriate for us not to plan for that. We also need to think of how we live with COVID as an endemic virus. We are going to see cases of COVID, and we need to think of how we're going to manage those, and that includes the variants of concern. And I've spoken about the booster vaccination already, and we will think about vaccination programs in the under-18s. This is something that's been discussed widely, and again, the risk-benefit would have to be carefully considered. So thank you very much.
Thank you very much, Dr. Brink. Our Chief Executive will now tell us about, as we relax the border rules and regulations, about some of the practical requirements. Paul.
Thank you, Deputy Furbush. Not too much from me today after that long brief from Dr. Brink. But importantly, with the move to Category 2, and mindful that positively much of the UK will fall under Category 2 on the 14th, we can expect more travellers. So it's really important that anyone coming over from any category country or region creates a travel tracker account online. That even goes for critical workers or for those travelling for medical or any other reasons such as compassionate. 2 days or less before you travel, you must then fill out your travel history and details about your journey on the travel tracker. It's an easy, straightforward online form, and it doesn't take very long. And you can find the travel tracker on gov.gg/coronavirus. And of course, if you really struggle, there is an alternative where you'll be helped on arrival. But we would strongly encourage to avoid delays and get you through the ports quicker to take that facility online. It is very simple. For those who arrive after the 14th as Category 2 arrivals, we really look forward to welcoming you upon your return or indeed arrival. And we are pleased that you'll be able to go out, see people, enjoy the islands once your test on arrival comes back, of course, negative. Please keep in mind the test on arrival can take up to 48 hours to come back. Often it is less, but not always. So please make sure you do plan to have somewhere to self-isolate for all of that time. And remember, it's not just a case of just going home or to your chosen destination and accommodation. It's a full self-isolation requirement until your negative result is confirmed. We're also preparing for what is likely to be more travel and arrivals in the bailiwick by way of private vessels once Category 2 comes in. Private vessels must also use the travel tracker, and in terms of how we manage the testing for those coming on private boats, we're reviewing some of the necessary measures. But I can assure you a facility and capability will be put in place to ensure those arriving on private boats will be tested in the same way and with rigour as others arriving at our borders. I can't give you the final details right now on how that will operate, but we will have those for you next week. The period between the 14th of May and hopefully changing to a less restrictive regime in July once our vaccination targets are met presents a significant resourcing challenge for us until then. We must maintain full testing capability at our ports, at the hospital for symptomatic and pre-operative testing, families with young children, and of course critical workers. Additionally, facilities for arriving private boats and craft, as well as maintaining our important surveillance testing regime on specific groups within the community. And indeed, most likely, the gradual increased numbers of travellers reflecting those arriving from Category 2 regions. As ever, we will endeavour to process those test results as quickly as possible, but as noted, this may well take up to 48 hours. We are starting to receive more calls to public health and our helplines about what travel is involved to various other destinations. Firstly, if you do have questions on that, please look on our website. All the information about arriving in Guernsey is there. However, it's important information about the rules in other jurisdictions. Please check with that jurisdiction. We do not have the details for every other country's entry requirements, and it will be your responsibility to make sure you're aware of those requirements before you travel. In regard to arriving in Guernsey, you may have questions, but please direct them to our non-clinical helpline on 717-118 or email COVID-19 inquiries at gov.gg. Lastly, please use the correct contact and information lines. And I would hesitate to encourage, please don't contact Dr. Brink and her team directly, or indeed Deputy Furbrush, as it really does slow things down and you can get to the information a lot quicker. Thank you.
Thank you very much, Paul. Press, your questions, please. Juliet.
I've got a few questions around vaccine passports, because also we're seeing what's going on in the EU and obviously in the UK. I think the UK, they're trying to work it around their NHS app. Can you possibly give us an indication of what sort of avenues you're investigating of what sort of options, like a piece of paper or an app, and when you're hoping to possibly, what sort of time frame you're looking to possibly try and introduce such a system?
Yeah, I'm quite happy to take that question. First of all, I'd give an absolute assurance that Guernsey is very much engaged in the front line with other Crown dependencies who are working closely together with the UK to see what requirement it will be for what's likely to be called a vaccine certification. I would say, though, that at the moment there isn't very much information at all about what's going to be agreed. And it's not such about the UK, but also internationally, it's not clear how a system could operate on multiple different applications. So I think it's quite likely where there might be some application where people can have their vaccination history, that some sort of certification, in other words, a hard copy will be required. And so we're working to see what that would look like, and we'll have it in place for the time that it's required.
Indeed. I mean, in relation to that, as Paul has said, there's still work to do. We know what we could do, but we've got to try and do something internationally, and they haven't. It's not as clear as it might be at the moment, but we're getting there. Next question, please. Matthew.
Matthew from the Bailiwick Express. I think this will be for Dr. Brink. And in a previous release, you said that stage 2 regions have below 30 cases per 100,000 people and meet other public health criteria. I was wondering what that other public health criteria is.
So there are a number of things that would be of interest to us. First of all, if a country had a very high level of variants of concern which weren't vaccine sensitive. So, for example, we know that the B117, the Kent variant, is the predominant variant in the UK now, and it is vaccine sensitive. So that would not be of concern for us. But if there was an emergence of a variant that, so for example, at the moment, the South African variant is the variant that we're most concerned about with regard to vaccine sensitivity. It does have some sensitivity, but it is the least, the vaccine is the least effective against that. But the emergence of a variant would be of concern to us. The other thing is if a country wasn't testing. So behind our prevalence is we look at positivity rates. So generally speaking, a positivity rate of 5% or less we'll be happy with. But if someone had a 25% positivity rate, we would be really worried, but a low prevalence, you'd be really worried about those testing rates. So testing rates, variants of concern, those are the type of things that we'd be worried about. Now, we've occasionally looked at an area saying we just don't have sufficient data to be confident, but that doesn't relate to areas in the UK or the other Crown dependencies. The data that we get from there is very good.
Thank you. Next question, please.
Ewan Duncan from BBC Guernsey. Are we still on track, as many islanders I'm sure have circled July the 1st in their calendars? Are we still on track to be saying we're going to open the borders, and is that going to be to the world, or as you previously speculated, it might be to the UK, the Crown dependencies?
Yeah, well, the answer is we're still on track for the 1st of July, albeit in this fast-moving world, things can happen over the next 2 months. At the moment, we don't envisage that they will. It would have been great to say it'd be open to the world on the 1st of July, but we're seeing what's happening in Europe and other places. They've still got very high rates of prevalence. So it's likely to be narrower than that, but there still will be many regions and districts that it can be opened up to on the 1st of July. I don't know if you want to add anything, Dr. Brink. Really.
I think you're right, is linking in with the UK and the Crown dependencies, where we know the vaccination coverage is high. I think, we are fairly optimistic that we'd be able to proceed with that. I think, as Deputy Fairbrush said, is we'd need to look more carefully at what's going on in the rest of Europe. So it's all about protecting what we've gained, but trying to allow as much freedom as possible.
Do you think July the 1st, if we're saying we're open to the UK, there's going to be a real push to say, look, UK, you're not really getting very far out of the UK borders, and you can come to Guernsey, it's safe, we're welcoming you, something we weren't able to say last year?
Yeah, I mean, that's it. That's what we're looking to do. It's likely to be sometime the world is not in the best place. There are lots of countries that are going to be months and months and months before they've got their vaccination process in any way that we would regard as safe and secure. But it'll be better. It's going to be better than it is now. And there's no reason why from the 1st of July, as we sit here today at the end of April, that we can't be welcoming people from different places, but not every place.
I think that's a good point as well, in terms of that period between the 14th and the beginning of July. As we've heard, there's an absolute intent to prevent us going down into lockdown until we switch to the vaccine-related method, really. But of course, we've got to remember, and it's very difficult for our hospitality sector to plan against that. So what they're obviously at the minute, if people were coming for a short-term break, there's still that requirement that I emphasised to self-isolate on arrival until you get your test, which could be up to 48 hours, which would be very difficult for someone coming on a short break, or even probably a week, knocking off 2 days. So I think really we are looking at July and beyond for inviting or welcoming people in for longer periods.
Next question, please.
Check which age bracket we're currently vaccinating, and also can you give me an update about the Moderna vaccine, because I haven't heard of it being given in Guernsey yet. What stage is that at?
So we're doing the 40 to 49-year-olds, but we go down it incrementally year by year because it's quite a big group. So we're working through those year by year. So that's the age group. The Moderna vaccine is we have it on Ireland. We hope to start administering it in the next month or so. What we need to do is just make sure that we've got all the indemnity and all the right checks and balances in place. But we fully intend using it on the island in the foreseeable future.
Thank you. Next question, Louisa.
Louisa, from ITV channel. Question about the students having a vaccine potentially in the UK and then coming back in the summer and having an extra dose. Does it matter which type of vaccine they've had in the UK?
We'll match it. So I would think most of the students in the UK will have had Pfizer-BioNTech because of their age, or they will have had Moderna. So what we're saying to them is get in touch with us and we'll get you on the scheduling board so that we know what we've got to predict. Our vaccine supply is really tightly controlled and we literally immunise down to our last doses. And so what we'll do is we'll bring them into that programme. But the data on heterologous programs, so one type of vaccine and then another type, I think it's likely to be available in the foreseeable future. But at the moment, the recommendation is that you give the same type of vaccine for both doses, if at all possible. And we will stick to that. And we don't see that it's going to be a problem accommodating the students with regard to that.
Ewan and then Matthew.
Dr. Brink, can you remind me of the passive follow-up qualifications? I think from what you've just said 10 minutes ago, it's slightly different to last year, where last year, if memory... if I'm remembering correctly, it was a case of don't go to restaurants, don't go to pubs, don't go to busy areas, but you didn't mention that this time. Is it now acceptable if you've arrived and within that 2 weeks of passive follow-up, you can go to a restaurant, you can go to a pub?
Yeah. So as ever, we look at the proportionality of our approach. So what you're referring to is enhanced passive surveillance, and absolutely we had that last year. That was against the background of an unvaccinated population. So when people come in, we're always looking at with our restrictions are proportionate. So what the mitigations that we have for now is our testing on arrival on day 7, together with a population that is increasingly vaccinated. So I think that's those are our key criteria at the moment. So the answer is no, we're not doing enhanced passive surveillance. Because the situation has changed for us, we're doing passive follow-up. So you're absolutely right, it has changed. Last time we had the 2 criteria, depending on which stage you were in travel, the first 7 days or the second 7 days, and we're not doing that this time. We're doing a simplified version.
Matthew?
I've got a bit of a follow-on from Ewan's question about passive follow-up. Do people who are in passive follow-up, can they return to jobs that are public-facing?
So those would then be a specific risk assessment with regard to those. So what we say with all of those, we would say what type of job you're doing and discuss it with your employer. So in most cases, the answer is yes, they could do. But we would recommend that they discuss it with their manager. So in health and social care, we'd look carefully at the job, etc., etc.
Next question. Juliet and then Louisa.
apologise for asking quite a numbers-heavy question here, but obviously the vaccine programme is going really well by the sounds of it. But can you maybe give me an idea of how much it's costing us to buy in the vaccines? How much each vaccine dose is costing? And are the UK selling it to us at cost?
Well, that last one is quite right, and we do get certainly the vaccines, as you know, we're getting from the UK, which is absolutely fantastic, and our cost for testing is around about £3 per unit, but of course that doesn't take into account the additional on costs of which work out £25 we think is about right for the travel related testing, but it doesn't cover all the resource implications and everything else that's involved with that.
Yeah. I think, sorry, Dr. Reed, you want to add anything?
So that was the testing.
Yeah.
So, yeah, absolutely. So the vaccination costs, I couldn't give you those off the top of my head, Juliet. I mean, I'm sure we could possibly work it out, but we have at any one stage 15 vaccinators per session to get through the huge numbers. So I think the costing of the whole programme is something that I'm sure we could look at with the sands of time, but I don't have that in huge detail, so I'm sorry.
Let me say this, we're very grateful indeed to the UK authorities.
Yeah.
We are very grateful for the way that they have allowed us to benefit from the vaccines that are available. Yeah. So we owe a great debt to them. Yeah. But as both Mr Whitfield and Dr Brink have said, there's the add-on costs of everything, and that is significant. It is costing the Bailiwick of Guernsey great sums, but of course it's money absolutely well spent. But again, I just finish as I began this little statement by thanking the UK authorities publicly for all that they've done. Louisa, your question.
Yeah, just a quick question about the travel tracker, about when you fill in the different regions that you've come from. I suppose at the moment you're kind of relying on people's goodwill to include where they've come from. Are there any concerns that kind of as we move towards this categorisation that people might sort of mislead the services on the travel tracker, and if there's any kind of...
Well, that's always a risk, but I mean, it's a criminal offence if they do that. They could get prosecuted and get very severely punished. But of course, you're relying on people's good faith and the good sense, so there could be no absolute guarantee. But we say to those that may be thinking of doing what you have said they might do, that if they're caught, this is a jurisdiction that will severely punish them. Matthew and then Ewan.
This all sounds like really great progress today. I guess my question is, when do you consider this to stop becoming an emergency and we will no longer need the CCA?
Yeah, that's a good question. We've asked ourselves that because we've been in this situation really for over 12 months now with the CCA, however it's been constituted sitting. We've got a fair bit of work to do over the next couple of months for sure, as the borders are relaxed and the regulations are eased a bit. There will come a time when we can't justify it, but at the moment it's still classified. We get advice from the law officers to make sure that we are acting within the terms of our mandate, that it is still an emergency, it is still impacting or potentially impacting upon the health of the members of the bailiwick. But there will come a time when we can say we've done our job for now and it's not a matter for the CCA anymore, but we're not there yet. And I would like to say 2 months, 3 months. It could be some time yet. Ewan. Just
touching on air bridges, I know you mentioned it at the start of today's conference, but the BBC spoke to Howard Quayle this week in the Isle of Man, Chief Minister, your counterpart, and was saying he would still welcome an air bridge, and he outlined the reasons for that on the basis of it would give vulnerable people or people who are shielding that extra security, that extra knowledge that they're going somewhere where it's safe and it's replicated criteria. Is it still something that you're saying, do you know what, we're reaching the point, 14th of May, it's 2 weeks away, actually it's not going to be too detrimental, so there really isn't a need for an air bridge, or do you think it could benefit those in the vulnerable shielding category?
We're not closing the door to it, it's just in practical terms, as you've said, we're 2 weeks away from the next stage, where Category 2, which is different to Category 1, because Category 1, different rules apply, much more relaxed rules. And there is still some time to go between now and the 1st of July when things will get, hopefully, even better. But looking at the practicalities of it, and I very much value the contribution that Howard Quayle and John Lafondre make, in our discussions that we have regularly with each other. But I think we might run out of time. And we've still got much work to do. And we want to bring our community with us too, to make sure that as we go step by step, that most people, the overwhelming majority of people, say, yes, we understand that you're taking the right steps. We've got confidence you're not going too quickly. Anybody else? Sorry, you and then Matthew.
Just a question about travel again. Do we have any forecasting for the types of numbers we might see leaving, we might see arriving, and if we're adequately prepared to cope with the numbers that we will see? I mean, obviously we've seen previously the amount of numbers of testing we've done and how well that was coped.
Well, we're liaising with the carriers in relation to the second part of your question to make sure that we can cope, because people have still got to be tested, etc., etc. And there's no point, silly numbers of 5,000 coming in, we can't test 5,000, which we couldn't do. But in relation to the first part of your question, there are facts and figures. The demand is rising and will continue to rise, but we don't believe it will be unmanageable before the end of June. I'm not saying it'll be unmanageable in July, but but looking at where the progressions are, we've spoken to the carriers, what figures are like to be in June, for example. We don't think, Paul, that it's going to be a major problem, do we?
It certainly looks more than manageable at the moment. We are really closely. I mean, it is difficult for the carriers. The carriers have got to put on the flights and obviously the ferry journeys and make that viable, and the scheduling that goes with that. But so far we're working with them and looking at the numbers, and it looks workable, and that's really important to the point that I said earlier on in the brief, as it's this stage between where we've moved to, or where we're moving to onto the 14th, through to where we'll swap from looking at prevalence in regions to basing it on our vaccination regime. The reason being is what's keeping us into the regime we enjoy today and not being in restrictions is that quite comprehensive testing regime that I ran through earlier on. And it's our intent to keep that on and keep us out of lockdown until we get to that target where we are with our vaccinations and we have a higher level of confidence. So we do think we need to hold in there between now and July and keep that testing capability as it is. And at the minute it looks manageable with the carriers.
Matthew?
Yes, you mentioned the booster programme in September. Do we yet know how long the vaccines are effective or you're covered for?
No, because we haven't been vaccinating people for long enough. So I think the predictive efficacy of the vaccination is at least 6 months, but it's probably far longer than that. So there are a number of challenges with the booster programme, and 3 that we particularly looking at. First of all, can the vaccine be delivered concomitantly with the flu vaccine? Because at the moment, as I'm sure most of your listeners are aware, there has to be a week apart between the flu and COVID vaccine. So can it be delivered concomitantly, one in each arm? So that's the first issue. The second is, should we be boosting with a vaccine that we're already using? And I think overall the feeling is, yes, we should be boosting with one of the currently available vaccines, whether it's Pfizer or whichever vaccine. So that's important. And secondly is the timing of the booster program. And thirdly, the timing of the booster program. And that then looks at exactly when it should happen. And we think it's autumn time. And the final thing is which groups. And the current discussions are around whether we should be giving the booster program to the same groups as we give seasonal flu to. So seasonal flu vaccine. So those are the discussions that are happening at the moment, but they'll continue over the next few months. But what we're starting to prepare for and think about is how we deliver this program. So that forms part of our forward planning for the winter season.
Any other questions? I don't see any. So our next broadcast will be on the 14th of May, and there are some milestones between now and the 14th of May. We've got this bank holiday weekend, and at the end of the bank holiday weekend on the Monday, we've got the new World Snooker Champion who will replace Ronnie O'Sullivan. On the 4th of May, I have my second COVID injection. And on the 9th of May, more seriously, on the 9th of May and the 10th of May, Guernsey and then Sark enjoy the Liberation Day festivities where we mark our liberation. And that's what we're trying to do in relation to where we are with the COVID programme, is move forward progressively so that the people can enjoy their lives with as few restrictions as are possible. So I wish everybody a good weekend, and thank you very much for your contribution.